My name is Dr. Patricia Chen, and I spent 12 years as a pediatric hospice physician. That is a job that sounds impossible when you say it out loud. Who wants to spend their professional life with dying children? But I did it for 12 years, which is either a sign of deep compassion or significant emotional damage, and I have never been entirely sure which. Probably both. The work transforms you into something you would not have chosen to become if you had understood the cost going in. It hollows you out in ways you cannot reverse. It also opens you to something most people never feel. I went into this work because I believed I understood loss. I had lost people. I had studied grief in graduate school and read all the literature about stages and processes and the work of Elizabeth Kubler-Ross. I had taken courses on grief counseling and learned the psychological mechanisms of bereavement. I had read the research on anticipatory grief and the particular trauma of childhood terminal illness. I thought my training had prepared me. It had not. Nothing prepares you for holding a 6-year-old as they die. Nothing prepares you to look into a mother's face and watch it break into pieces. Nothing teaches you how to sit with the weight of that particular helplessness, the knowledge that you cannot fix this, cannot solve it, can only be present. I stayed because every time I thought I could not continue, I would meet a child who needed someone to bear witness, and I could not leave. I could not walk away from their eyes. I have held 73 children as they died. I know this number exactly because I keep a notebook with their names. I write their names and the date and a single sentence about what made them different from every other child. I reread that notebook sometimes at night when the weight of it threatens to crush me. I read it as a kind of prayer, a practice of remembering, a refusal to let them become abstractions. I developed a protective shell over those 12 years. I learned to distance myself clinically from the suffering. I learned to see the disease rather than the person, the diagnosis rather than the eyes. This was not cruelty, it was survival. You cannot stay present to that level of pain and remain functional. I watched my colleagues burn out. I watched them leave the field entirely, unable to continue witnessing the slow decline of children they had grown to know. I learned the survival strategy. Do not get too close. Do not become invested in the outcome. Do not allow yourself to grieve each loss fully. I learned to manage conversations with parents by focusing on comfort care and palliative options, using language that was gentle but distant. I learned to turn off my emotional investment the way you turn off a machine. I could spend an hour with a family devastated by their child's prognosis and then move to the next chart, the next case, the next impossible situation. I built walls that I did not know were there until my near-death experience began to dismantle them. I learned to document what I witnessed without feeling it. I learned to separate the observer part of myself from the human part. I became a professional, which meant I became partially inhuman. I became excellent at it. I became the person people called when they needed someone who could remain calm in the presence of the unbearable. One of them, a girl named Lily, was 3 years old and had acute leukemia. She would sing to herself constantly. Not songs from movies or television shows. Songs she made up as she went. Melodies that seemed to come from somewhere inside her, somewhere beyond the reach of chemotherapy and transfusions and the invasive procedures that define childhood terminal illness. She would lie in her hospital bed, barely able to move, her small body ravaged by disease and treatment, and produce melodies that sounded like they came from somewhere other than a 3-year-old in a pediatric ward in Cincinnati. The songs were astonishingly beautiful, and they were from somewhere genuine, somewhere that had nothing to do with the things that were destroying her body. I asked her once where the songs came from. She looked at me with a seriousness that no 3-year-old should have to possess, and said they came from the happy place. She said she could already hear it sometimes. She said it was singing, too. She said there were other children there. I filed that memory in the part of my mind where I kept the things I could not explain, the things that did not fit into the clinical protocols I relied on. I held on to that memory like a secret. I did not know what to do with it. Part of me dismissed it as the imagination of a dying child, the mind's way of creating meaning in meaninglessness. Part of me, the part that I did not allow to speak during those professional years, wondered if she was telling me something true. I was 46 years old when my heart went wrong during a procedure in 2018. It was a routine surgery for a cardiac complication that should have been straightforward, a technically simple intervention that I had scheduled between my regular hospice cases. What should have been a short hospitalization became a 7-minute cardiac arrest on the operating table. 7 minutes is enough time for things to happen that change a person permanently. 7 minutes is a long time when it is happening to you. 7 minutes is long enough to die. 7 minutes is eternity compressed into a moment. 7 minutes is the difference between before and after, between the person you were and the person you become. There was a moment when the pain stopped, just stopped. One moment I was aware of the surgery, aware of the presence of the surgical team around me, aware of the specific quality of being open and exposed on the operating table, vulnerable in a way that physicians spend their careers learning to avoid. And then all of that awareness shifted. It moved. And I was not in the operating room anymore. I was not in any physical location I could identify. I was not on a table, not in a hospital, not in my body. I was in a place that I cannot describe except through what it was not. It was not cold. It was not frightening. It was not confusing or chaotic. It was the opposite of all those things. It was familiar in a way that suggested I had been there before, perhaps before this life, perhaps in the part of me that exists outside of time and form. It was home in a way that had nothing to do with a place and everything to do with a state of being, a frequency of rightness that my nervous system recognized completely. And it had a sound. There was music. Not music the way we use that word for organized sound on a speaker or from an instrument. Not melody and harmony in the conventional sense. This was something the environment itself was doing, the way space itself was vibrating, the way light has wavelengths and radio waves carry signals through the air, the way matter vibrates at different frequencies. There was a quality to this place that I can only call musical. It was the sound of existence, the sound of consciousness itself moving through form. And it was familiar. I had heard it before. I had heard it everywhere, all my life, but so quietly that I had mistaken it for silence. I had thought the silence between sounds was nothing, was the absence of something, empty space, void. I understood now that the silence was the underlying harmony, the foundation underneath all the noise, the song that had been there all along, underneath every conversation, every heartbeat, every breath, every moment of suffering. And I understood where Lily's songs came from. She had not been making them up. She had not been imagining them. She had been translating something she was already hearing, something that the dying begin to perceive as the body releases its grip on consciousness. The 3-year-old dying of leukemia in Cincinnati had been receiving a signal I had been too busy and too clinical to notice. She had been receiving the music. She had been trying to teach me what she already knew, and I had been too distracted to listen. I had been trained to discount her experience as imagination, childhood fantasy, the mind's way of coping with pain. I had been wrong. I was not alone in that place. There were presences I could feel more than see, consciousnesses that communicated without language, without the limitations of verbal exchange. I understood, without words, that the children I had held for 12 years were fine. That is the word that came to me. Fine. In the deepest and most complete sense of that word. Not a comfort, a fact. Not a reassurance, but a truth that required no reassurance. They were fine. They were all fine. Every single one of them was fine. The 73 children in my notebook, all of them, thriving, complete. Home in exactly the way Lily had described. There was no suffering where they had gone. There was only the music. I chose to come back, though chose is not quite right. I understood there was more to do. I understood there were more children who needed to hear what Lily had heard, and I was the person who had been positioned to tell them, who had spent 12 years learning to listen in the most difficult place, learning to recognize the difference between pain and presence. I understood that my job was not finished. I understood that I needed to return to the work I had almost stopped doing, to return transformed. I woke up in the recovery room with my cardiologist leaning over me, wearing an expression I recognized as the expression of a physician who has watched something that did not follow the expected protocol. He said, "You were gone for a while," and I said, "I am aware of that," and then I cried, which is not something I do in front of colleagues. I cried because I knew. I knew what was real, and I knew what I had been missing. I cried because I had spent 12 years with children who were hearing music, and I had been hearing their pain instead of their translation. I had been trained to manage their suffering instead of honoring what they were perceiving. I had been so focused on my clinical role that I had missed the most important thing about the work. I could not go back to pediatric hospice work immediately. I took 6 months off. I could not sit beside a dying child without wanting to tell them what I had heard on the other side, and I was not sure yet that I had the language for it. I could feel the old clinical distance dissolving in a way that felt dangerous to my professional identity. I spent those 6 months listening differently, learning to listen in a new way, listening to what was underneath the music I already knew, the song that had always been there, which is a way of learning to listen to life itself. Listening to children who were still living and beginning to understand that some of them were already hearing it too. Listening carefully to the older children talk about what they heard at night, when everything else was quiet, the music Lily had been translating all along. I began to understand that the ability to hear this frequency was not reserved for the dying. Children are naturally open to it. They have not yet learned to dismiss what they perceive as impossible. I went back to work. I sit differently with children now. I do not manage their fear with the clinical protocols I learned in my training, though I still understand those protocols. I listen to what they are already hearing. I have learned to ask them different questions. I ask them what the singing sounds like, if they can feel the happy place, if they are ready to go there, or if they are waiting for something first. I sit in silence with them in a way I would never have permitted myself to do before. Not listening for the clinical signs of approaching death, but listening with them to whatever it is they are hearing. The children who are very close to the end often become calm in a way the adults around them cannot account for. Some families interpret it as resignation or sedation from medications. I think they can hear the music getting louder. I think as the body weakens, the other senses sharpen, and they are perceiving something that is becoming clearer to them, moment by moment. I think it is genuinely beautiful to them, and I think the thing Lily was translating, those songs from the happy place, was exactly what it sounded like. It was the music underneath everything. It was the sound of home. It was what they had been listening for all along, before they were ever born into bodies that were destined to fail. The music does not stop. It is not a metaphor. It is not poetry or spirituality or wishful thinking. It is something this world is embedded in, and that we stop noticing the way we stop noticing our own heartbeat, our own breath, the constant pulse that keeps us alive. When the body quiets enough, the music becomes audible again. And every child I sat with who went peacefully at the end was, I believe now, simply hearing it clearly for the first time since they arrived here. They were hearing what Lily heard. They were hearing the song that had been waiting for them all along. The children know the truth about death in a way that adults have had to unlearn. They are not afraid because they recognize what is calling to them. They are going home. I spent years carrying this knowledge without knowing how to offer it to the families who needed it most. I spent years watching parents grieve, watching the devastation of children's deaths, wanting to tell them what I knew but not having permission to speak it, not having a language for it that would not sound insane. But now I do. I put together a short guide about the signs and experiences that happen in those final hours, things I wish someone had handed me before I spent 12 years wondering what the children were already hearing. The signs of approaching peace, the changing quality of breathing, the way consciousness seems to drift towards something the body is releasing. The link is right below this video, because the music is real. And the happy place is exactly what Lily said it was.